Hello, my name is Leo, and I want to take a moment and talk to you about antihypertensive drugs. First off, I'm not a doctor, I'm not a nurse, I don't work in the medical profession. I work in the subway. I manage a subway station. So I'm just somebody afflicted with this disease of hypertension. So, I also have obsessive compulsive tendencies, so I've done a lot of research on antihypertensive drugs. Okay, first of all, let's say you go to a doctor and your blood pressure is running over 140/90 on more than 3 occasions. Chances are your doctor will put you on antihypertensive drugs. They have to, okay? Because let's say you're going to the doctor for about a year and your blood pressure is, 2 years, year, 2 years. Every time you go in, your blood pressure is high. They don't do anything. You stroke out. Next, you get a lawyer, you sue malpractice. So they're legally bound to suggest antihypertensive drugs, and whether you take them or not, that's up to you. And if you don't take them, it makes their job a lot easier. They can write patient refuses treatment. Okay, so there's various types of antihypertensive drugs I would like to discuss at this moment. Okay, I have a list here. The most popular ones are diuretics. They're cheap, and they have been proven to be effective, especially effective for African Americans. The thiazide diuretics are normally used, and the way they work is they get your kidneys to excrete excess salt, and by excreting excess salt, you excrete excess water, and where you want the water out of is your blood vessels. Less plasma volume, in your arteries and veins equals less blood pressure, in theory. Okay. Thiazide diuretics have a number of side effects. Well, one, you're pissing all the time, which, can make for a miserable existence. They kind of drain you, and they've been proven to, they can lead to erectile dysfunction. So my advice, is to, if you're going to take a thiazide diuretic, stop at 12.5 milligrams hydrochlorothiazide. Next class of drugs I'd like to discuss are ACE inhibitors. I'm personally on ACE inhibitor, lisinopril, and the way ACE inhibitors work is your kidneys secrete angiotensin converting enzyme that tells your blood vessels to constrict. The ACE inhibitor blocks this, so your blood vessels are more dilated. So it's great drugs. I highly recommend them, and they've been proven to be most effective for Caucasians. Okay, so if you're not African American, I would suggest opening up with a ACE inhibitor. See how that works for you. Okay, like lisinopril or a long-acting ACE inhibitor. Okay, another class of drugs is angiotensin receptor blockers. Okay, basically, the ACE inhibitors prevent the message to constrict from being sent, but the angiotensin receptor blocker prevents the message from being received. So the end result is the same, vasodilation, or less vasoconstriction. Okay, and angiotensin receptor blockers are often used because ACE inhibitors, one of the main side effects is it can give you a cough, and angiotensin receptor blockers, that's less likely to happen. Okay, another class of drugs, calcium channel blockers, which are essentially vasodilators. Okay, I'm on amlodipine. I take lisinopril in the morning, amlodipine at night. And basically the way calcium channel blockers work is your blood vessels, and heart need calcium to constrict, and basically the calcium channel blocks the calcium from getting into the walls of the arteries and heart muscle, and result being vasodilation and reducing the force of your heart's contraction and lowering of the blood pressure. Okay, amlodipine is probably the best, in my opinion, the best calcium channel blocker to use, because the other ones like verapamil, one of the main side effects is gingival overgrowth. Your gums can get this deformed growth going where your gums look like cauliflower. So that's one of the main side effects. Because amlodipine, that's rare. So I definitely recommend the amlodipine. Let's see what we got going on here. Okay, then we got beta blockers. Beta blockers basically suppress your adrenaline, and I mean, they're good anti-anxiety drugs. A lot of musicians use them, you know, to keep from getting nervous. They really helped me out when my mom died, you know, kind of calmed me down. But in my opinion, beta blockers are not a good drug for long-term treatment of hypertension, because first of all, they kind of, for me, they kind of zombied me out, made me feel like I was smoking too much bad brown weed. And also, they definitely lead to erectile dysfunction. I could tell right off the bat that, man, you know, I wasn't getting as hard. So basically, I would not recommend beta blockers for long-term treatment of hypertension unless you're a female tweaker, you know, or for short-term acute anxiety situations. But in that case, you may need a benzo. So basically, my personal recommendation is an ACE inhibitor, angiotensin receptor blocker, or a calcium channel blocker. But if you're African American, you know, in good conscience, I have to recommend, you know, 12.5 milligrams hydrochlorothiazide if you can tolerate it. But okay, another factor I want to discuss is combining antihypertensives. Normally this is done because your body fights to maintain a certain blood pressure that it likes. Okay, so let's say you open up with a diuretic and reduce plasma volume. Okay, and you have less plasma volume. Okay, now your body's gonna be, oh my God, the blood pressure's too low. It may be too high, but your body's like, oh my God, it's too low. So it sends a message to constrict your blood vessels. Now you add in the vasodilator like a ACE inhibitor or ARB to dilate your blood vessels. Okay, so ACE inhibitor with a diuretic is a popular combo. Okay, but then let's say you're really drug resistant. Your body can be, oh my God, the blood pressure is too low. So it increases the force of your heart's contraction, so your heart just beats harder. Okay, and the way to offset that is you add in a calcium channel blocker or a beta blocker to reduce the force of your heart's contractions. So, you know, my advice to you is, you know, experiment with some different drugs. You know, a lot of these people I talk to say, oh man, you know, I want to be drug-free, I want to be all natural. But hey, go ahead and be the most all-natural man in the cemetery. You know, me, I was that way for years. You know, basically 30 years untreated hypertension is enough. I mean, I'm down with taking some drugs, and you know, experiment with the drugs. Man, you can always stop taking the drugs. You can always reduce your dosage, but it's pretty hard to reverse the effects of a stroke. So that's my little bit of knowledge for you today. There's other, you know, classes of drugs, you know, minor ones like, you know, clonidine and things like that, but those are the primary classes of antihypertensives. You know, with that, I'm out. Farm up, pseudocial down.